Hey guys, it's Matthias Allred. It's November 1st, open enrollment for healthcare plans for 2017. I'm excited to get a lot of my clients taken care of on this. We've had a lot of phone calls as to why you need a health insurance agent, and I thought I'd put this together. But first, I want to tell you, when I jumped on healthcare.gov today, it's the first time in my life I've ever been put on hold online, right? I've been on hold on a telephone before. I've called up and people have been busy and not able to talk, but I've never gone to a website and been put on hold saying, we have too much traffic, we're not able to help you right now. Very entertaining for me, can be very, very frustrating for a lot of people. So another great reason why you ought to use an agent. So here's what we're going to cover in this presentation. Who do you turn to for help? What if you already have a plan? The benefits of using an agent. Some examples of the confusion out there on different plans. We're going to talk about us as agents and how we get paid, and then what you need to do next and how do you relax and celebrate. So first off, I wanted to just go over this terribly awful image right here. Illiterate, right for free help. This is wrong on so many levels, but it is kind of funny because the information's right in front of this person, but if you can't read, then you can't really understand it. Or it might be there that you can look at it, but you're not really understanding what it's saying. So if you're illiterate, how are you supposed to read the billboard, right? And right for free help, really, if you're illiterate, you don't know how to read or write, and so it just doesn't make sense altogether. Very confusing and frustrating, and oftentimes, guys, that's what's going on with the health insurance and open enrollment. So what can you do? Who do you turn to for help? Well, you can do it yourself, and that we don't even need to go there. We know how that's going to turn out. You can jump over to healthcare.gov, and they have some great resources on there. But remember that their employees do just get a limited amount of training. They're called navigators or application counselors. Really what they can do is tell you what buttons to click on, but they can't really give you any advice on any personal recommendations. They really have handcuffs on them on what they can do. The government has a nice CYA policy that really limits their ability to help. And so your next option is a local health insurance agent, and that's us, and that's what we do. We're trained in the state of Utah. We get direct training from all of the carriers, so we know exactly what we can do to help advise on the right plans that are going to fit you and your family. So what do you do if you already have a plan? Do you really need an agent? Well, if you're enrolled in a 2016 plan, either through the health exchange, through healthcare.gov, or directly with a carrier, and you don't have an agent, or you don't know who your agent is, or they're not being very helpful for you, then yes, absolutely you need an agent. You should really consider putting an agent on your application. You're already paying for it. We'll go over that down in a little bit. And an agent can help you down the road. If there's ever any problems or issues that come up, an agent can get involved and help you instead of leaving you to fend for yourself with the different carriers. So on the health exchange, if you're filling out the health exchange under the getting started, you'll go through the privacy policy. Number 3, under help applying for coverage, you're going to put in my name, Matthias Allred. I've mistyped that. There's 2 L's in there. FFM user ID, make sure you put that in there. But the most important and most critical is the NPN number. That's our national producer number. And this is what ties your account to me so that I can actually get on and help you with any changes or adjustments that you need to make on here. We can also do the enrollment for you. I'll get in that in just a bit. So hit pause on the video if you need to take a closer look at this, but here's that same information right here. So real quick, the benefits of using an agent, really it puts you back in control. I know often it's very frustrating and feeling out of control when you're trying to sort through all the health insurance stuff, and having an agent on your side really puts you back in control. Helps you take advantage of the tax credits, making sure you don't miss out on any deadlines, making sure paperwork gets submitted on time, and also very helpful, they can help pick between the plans that are out there, help look up a doctor or review any prescription or medical drug coverages that you might need. And one of the big kickers right here is that we can actually help you complete the enrollment for you, right? So a 15 or 20-minute phone call with us, we can gather all the information that we need, and we can actually do the application for you. So you don't have to spend 1, 2, 3 hours on hold with healthcare.gov, or getting on the website and get partially through it and have to go back and fix things, or getting kicked out of the website. It's crashed on me several times. It can just be a headache on here. So anyway, the agent that can really help you enroll on that and take that off your plate is a really big deal for you. Here's an example I wanted to show you real quick of 2 different plans that we found on healthcare.gov. Excuse me. Let me just pull this on here. The information that I put on here is a family of 5, husband and wife, 3 kids, making approximately $60,000 a year. Here are the 2 plans that we're going to compare. It's the Select Health, Select Med Preference Benchmark Silver 1500, and the Select Med Preference Silver 15100. The only difference in the wording is this word benchmark right here. But if you jump on healthcare.gov, you're going to see the exact same plan, exact same information. As you go through here, you're just going to notice that the price is a little bit different, right? $545, $564. It's just under 20 bucks a month difference on here. And then you scroll through and everything else appears to be exactly the same. The deductibles are the same. The out-of-pocket coverages are the same. If you get into the specifics on here, same here, right? Primary care doctor, $35 copay after deductible, $35 copay after deductible. Everything lines up here almost exactly. In fact, I had to spend quite a bit of time going through these to try and decide if there really was a difference on here. And I'll tell you, last year I made this mistake. I hadn't had the training that I needed to from Select Health. This is my first year running the health insurance stuff. And I picked a benchmark plan. Well, come to find out that the benchmark plan doesn't cover any durable goods on your healthcare needs, such as if you ever need crutches, if you need a wheelchair when you're in the hospital to get wheeled around, if you're on a CPAP machine, it won't provide coverage for that. Eye exams are a big one. My wife went in to get an eye exam and it cost us $250 because we had a benchmark plan and the eye exam, the annual eye exam, wasn't covered on here. And so for a minor 20 bucks a month difference, I think ours might even have been a little less last year. God, I would have gladly updated to this preference silver plan if somebody had just told me and advised me on here. So if you really scroll down here, actually do a search for eye exam, we can get down here. Yep, routine eye exam, benefit not covered. And here it's covered with a $60 copay after you reach your deductible. So would have saved me and my family $250 this year on insurance. Guys, this is the benefit of having an agent, is that we can go through these plans. We understand what these different words mean and what it can mean for you and your family. So which one do you choose if all the plans appear the same? Well, if all else is the same, then price wins, right? But like we just showed you, what if they're not the same? And oftentimes when you're comparing these plans on healthcare.gov, they're going to appear to be the same, or you're not going to notice a difference on them, but there really is a difference on there. So real quick, I want to touch on this because we get these questions. How do we get paid? We get paid by the health insurance companies, not by you. And our commissions are already built into the price that you pay, meaning whatever price you're going to get from us is the same price you're going to get from Select Health or Molina or healthcare.gov. The pricing for all of the plans are all of the same, and the cost of the agent's commission or help is already built into that. So we get paid based on the number of people that we help, and we will never, ever, ever send you a bill for our services, right? You don't pay for our services at all. It's all covered by the insurance company. And just as a side note, we never make recommendations based on our commission because our commissions are about the same anyway. So we want to make sure the plans that we put you in are going to be the most beneficial for you and your family. So what's next? What we can do to make this easy for you? A 15 or 20-minute phone call. We can gather all of the information that we need from you. We can show you different plans, make sure all of your needs are being met, and then we can complete all of the enrollment for you so that you don't have to worry about it. Don't worry about calling our office. You can, but the best way to get in touch with us is via text message. Send us a message. Let us know when you're available to chat, and we'll call you back on that time. We tend to be very busy during open enrollment, helping as many clients as we can, and we want to make sure you're taken care of too. So text message or email is the best way to set up that appointment, and we'll get back to you. If you do want to call us, you can, but leave a message if we don't answer. And then lastly, just celebrate and relax. All your health insurance is going to be taken care of. You don't need to worry about it. Enrollment's going to be done. We send you all the confirmations and make sure everything's taken care of on your behalf. Lastly, help your friends celebrate too. Never fun to celebrate and watch your friends suffer in misery. So send them a copy of this video, tag them on social media, share the message that there are agents, whether it's us or somebody else out there that can help them navigate this whole nightmare that is healthcare.gov and open enrollment. So appreciate your time. Again, my contact information, and we'd love to talk to you. Thanks a bunch.